The philosophy and mission of the Waterman Heart Center is to provide excellent quality care, transparency of results, and what we call a multidisciplinary program. And we've learned from our cancer associates that multidisciplinary care is really the best way to take care of patients, and I'll take a minute to describe what that looks like. On the front side of the equation, multidisciplinary care means that we gather all of the data, all of the blood tests, EKGs, angiograms, stress tests, so forth. And we review that data in what we call a collaborative practice. So that means surgeons, cardiologists, critical care physicians, anesthesiologists, case managers, diabetic educators, cardiac rehab specialists. And we take a look at that data and we try to understand as a group what's the best method to take care of the patient. Does that require surgery? Does that require medicines? Does that require stenting? And we come up with a collaborative answer on how to take care of the patients. It's a very powerful tool when we go back and we talk to the patients and their families, that it's not a single individual who makes these decisions. It's a team of dedicated professionals who do that. It gives greater depth, I think, to our convictions. After we're done taking care of those patients, afterwards, after surgery, we take care of them in a similar way, and we have what we call interdisciplinary rounds. So if you take a look at traditional medicine and how patients get taken care of, I've always thought it looks a little bit like an ant farm. You know, if you play it in fast forward, someone comes in, someone comes out. An hour later, someone comes in, someone comes out, and that goes on more or less through the entire day, to where by the middle of the afternoon, you've had probably 5 or 8 individuals come in to take care of somebody, and they have some natural conflicts on their care ideas and philosophies. Well, what we've decided is we get the entire team together, similar team to how we described in the collaborative practice. This time it's a little different though. It's the operating surgeon, critical care physician, bedside nurse, charge nurse, case manager, diabetic educator, pharmacist, nutritionist. And we take care of every single patient one at a time with that care package. When there's issues to be resolved, we resolve them in real time. The patient and the family know when we're coming, so that when they have their questions and their concerns, they know when to voice them. And by the end of that interaction, we've really provided a very deep plan with all the experts that are involved, so that by early in the morning, that plan of the day is set, and there's not really very much mystery or conflict built into the equation. And that's something we think is pretty unique, and we think that that provides not just better patient care, but also better results.